Well, hi, everyone. Thanks for tuning in. And thank you to everyone at Kirkwood and at Linmar for this opportunity. Hopefully, it's beneficial. I have not given an online presentation before, so we'll see how it goes. Okay, can you see my presentation? Okay, perfect. So like Cheryl said, my name is Recker. I am currently working as a general dentist at Marion Dental, which is conveniently located right across from Linmar High School if you ever have any problems. A big question I get is how I became interested in dentistry. And it started when I was in high school. I had an early interest in healthcare. I didn't quite know what route I wanted to take yet, being a doctor or a nurse or a dentist. I really like working with and helping people, and I like doing arts and crafts and working with my hands. So I like to do what I call grandma crafts, just like knitting and cross-stitching and things like that. So very little meticulous things, which come in very handy for dentistry. I spent a lot of the time in the dental chair growing up, but not because I had cavities. My baby teeth didn't want to fall out on their own, and so I had a lot of help with that. And fortunately, I only had good dental experiences growing up, and so I think that left a really positive impact on my decision to become a dentist. And I also shadowed both my dentist and my orthodontist in high school just to see what it was like. So a little bit about education. We're going to talk about the path to becoming a dentist. I graduated from the University of Iowa with a bachelor's in integrative physiology, and then I stayed in Iowa City for dental school. The dental school at the University of Iowa is the only dental school in the state of Iowa. So things start out and you get your high school diploma. From there, you attend college, and then it's dental school. And then after dental school, we are required to do continuing education. And so that can be online courses or hands-on courses in person. You can also get credits at meetings that you go to and things like that, just to make sure that we are keeping up on our skills and able to provide the best care possible for our patients. So when I talk about requirements for dental school, I'm specifically talking about the requirements that the University of Iowa Dental School has. And you'll have to check with each university individually to see what their requirements are. But for college, to get into dental school at Iowa, you actually don't have to have a degree. However, you must complete 90 semester hours at an accredited college. And over on the right-hand side are all of the prerequisite courses that you must take in order to apply to dental school. Most people who apply do have a science major background, but you do not have to pursue that if you don't want to. And the average GPA for entering dental school right now is above a 3.7, so it's pretty competitive. Another thing you have to do in order to go to dental school is to take the dental admissions test, which is called the DAT. It's similar to the MCAT for medicine and the LSAT for law, if you've heard of those. Those are pretty popular compared to ours. It is a test that is broken down into 4 sections. You're allowed 4.5 hours. And the sections are science, reading, math, and perceptual ability, which is basically your ability to reason in 3D space. And it's a lot of puzzles and fitting cubes into holes in certain directions. It's very interesting. It's kind of fun. It's good for puzzle people, but not something that you would expect to be on a test like that. It is scored 1 through 30. The national average is a score of 18. The Iowa averages are higher than that. The academic average, which is the science, reading, and math, is a 20.5, and the average for perceptual ability is 21. So once you've taken your prerequisite courses and you have your DAT score, it's time to actually apply to dental school. And you can apply to as many schools as you want to through this ADSAS application, which is a centralized application service for all pre-dental applicants. From there are schools that require a secondary application, but they will let you know. And the ADSAS application consists of your biographic information about your education, where you went to high school and college, and you send all of your transcripts. So that includes your GPA. They receive your DAT score. You also include professional experience. So if you've had shadowing experience or any work experience that you'd like to list. You also include a personal statement, which is a really short essay, probably about a page long, about why you have chosen to pursue a career in dentistry. Finally, you need 3 letters of recommendation. Those are usually from professors that you've had or mentors, definitely somebody that can speak highly of you and somebody that knows you very well. Another thing that looks really great on an application is volunteering and extracurriculars. At the University of Iowa, there were hundreds of student organizations, and so it was super awesome to be able to look through those and kind of pick and choose. Community service and volunteering are also looked very highly upon. And then extracurricular activities. So it's super awesome to be able to continue your hobbies in college. It also makes you look more well-rounded as an applicant. So when I was at the University of Iowa, I chose to continue some of my hobbies and then pick some volunteering or philanthropic organizations to serve as well. I chose to spend 4 years with Dance Marathon, which is a philanthropic organization that raises money for children with pediatric cancer. And we culminate our year in the big event, which is 24 hours where we don't sit and we don't sleep. And we do a lot of dancing and we listen to family speakers, and it is truly an amazing event. In the middle, my senior year, I was part of an Indian dance team. I was a big dancer growing up, but never in this style. So it was really fun to branch out and give that a try. And then I was big into choir in middle school and high school. So I chose to continue singing in college for both my junior and senior year. And that was an amazing opportunity. When I was a sophomore in college, I also had the opportunity to take a dental mission trip to Panama through an organization called Global Medical Training. And I was there for about a week. And we treated patients from Panamanian villages that were really off the beaten path and did cleanings, and we took out teeth. And it was a very, very humbling experience. It gave me a lot of perspective about how lucky we are to live in the United States and have access to all of the care that we do. And if you have the opportunity to take a mission trip, I highly recommend it. So now hopefully you've gotten into dental school. What should you expect? Dental school is 4 years long. And again, I'm speaking specifically to the curriculum at the University of Iowa College of Dentistry. Our curriculum is pretty unique in the way that it's structured. So if you want information about other colleges, feel free to check out their dental school websites. In our first year, we attended a lot of lectures and we did a lot of preclinical training. So on the right-hand picture there, you will see my friend LeVar. He was my dental school mannequin. You will also notice that his upper lip is pulled up over his nose, which is definitely not allowed in a human patient, but we were learning. And we spend a lot of time drilling on plastic teeth. So before we ever do a procedure on a patient later on in dental school, we learn how to do it on plastic teeth first. And then we actually saw our first patients for cleanings at the end of the year. So we brought in our friends and our family and learned how to do a hygiene appointment. And that was really our first experience in patient care outside of all the drilling and filling we'd been doing on our mannequins. In the second year, you still have lecture, but then you transition to the clinics for operative. And operative is drill and fill dentistry. And you still continue your preclinical training for more advanced procedures, so like crowns and root canals. We spend a lot of time in the simulation clinic second year. You can see some of my friends and I cleaning up some of the messes that we had made. It gets kind of gory sometimes. And then Boards are a big part of second year, and they are currently in the process of making a lot of changes to when and how the boards exam is administered. But when I took boards the second year, it was a written board exam. And you can see my flashcards there. I spent a lot of time studying and preparing for that. It is a test that is on the computer, and it is a long day. I think you're allowed up to 8 hours to complete that test. And it covers basically everything that you've learned your first and second years of dental school. So once you've passed boards and completed all of your courses for second year, you move into third year. And this is where the Iowa curriculum stands out really strongly because we get a ton of clinical experience. So we still have our lectures, but we are no longer in the simulation clinic, and we see real life patients every day, which is super cool. We also have the opportunity to rotate through all of the specialties throughout the year, and our year is divided into 2 blocks. So in the first block, there's operative, which is drilling and filling, oral surgery, which is removing teeth, pediatrics, which is dentistry for children, and radiology, which is how to take x-rays and how to interpret those x-rays. The other part of the year we spend in endodontics, which is root canals, periodontics, which deals with the support structures of the teeth, so the bone and the gums around the teeth, and then prosthodontics, which deals with replacing teeth that have been lost for whatever reason. So third year is very, 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 very busy. Everyone will tell you that it is the most challenging year, but it's also the most rewarding year and the year that you learn so much and you get to make a huge difference in the lives of your patients. It is unique because when people come to your clinic, that patient is only seeing you for that one procedure. And then if they need other work done, they go to a different clinic. So on the right-hand side is an example of a case that I did during the prosthodontics rotation, and it consisted of 2 crowns and a bridge for one of my patients who actually had dropped her phone on her face when she was laying in bed. So please get a pop socket or be very careful because it can cause the need for some extensive dental work. And then she was missing a tooth on the upper right, and that's why we did the bridge. The fourth year of dental school, the light at the end of the tunnel. So we spend the year in what we call family dentistry, and it is designed to mimic a day in the life of a real dentist. So you do all of the treatment that your patient needs from start to finish. And the second part of the year, you do extramural rotations. And I say second part of the year because I was in the group that did our rotations last, but those are 2 5-week blocks where you go out into the real world and do dentistry. So I had classmates who went to different states to do that. I had classmates who went abroad to India and to the Netherlands and to Spain. So that was an amazing experience for them. And I spent 5 weeks in our geriatrics and special needs clinic, and then 5 weeks at St. Luke's in Cedar Rapids, where they see pediatric patients and patients with special health care needs. A big part of fourth year is also boards. So that consists of a 2-day written examination and then a live patient portion, which again, they're looking at changing, but this was just my experience. On the right-hand side, you'll see a bunch of my members of my group. So you're split into 4 groups, and that determines when you go on your extramurals. And that was after we found out that we had passed boards. So we were really excited about that. At the College of Dentistry, there is a tradition that when you complete all of your patient requirements, you run around the school ringing a cowbell. I don't know why, but it was probably one of the most fun things I have ever done. And everyone is so happy for you. And just pure joy. So I also brought confetti poppers and really hammed it up because it was a really important thing and a really cool accomplishment. And then finally, graduation. You get your diploma, you start looking for jobs, and you're kind of on your own. So dentists have to have a lot of skills, and these are some of the things that I think are the most important. Being dexterous. So we work with our hands all day long. Detail oriented. Obviously, we are working in a very small portion of the body, and one that you really want to look nice and to feel nice. We are compassionate people, so we care a lot about our patients. We have to be patient with our patients. Some of them have had negative experiences, and we have to be able to guide them through our procedures. And there are totally different levels of dental literacy as well. So we have to be able to break down what we're doing and to customize treatment to every patient. We are organized, so there are a lot of steps that go into procedures and then sending cases out to the lab. We are great communicators. So not only do we have to get the message across to our patients, but we also manage our staff, and we work with labs and other outside organizations to put our cases together for our patients. Similarly, we are team leaders. So we are kind of at the top of the totem pole, and we have assistants and hygienists and office managers that help us put our day together, but we are looked to for kind of the final say. We are problem solvers. As you can imagine, sometimes there are things that occur, accidents, traumas, big problems that we might not have even seen before. And we have to be able to figure out a logical and ethical way to solve that problem. Finally, we are negotiators. And this was a portion that we didn't get much training in dental school because we don't have formal business training because we're so busy learning the clinical aspects of dentistry. And so what you recommend for your treatment might not always be the treatment that your patient is interested in. And a lot of that has to do with finances, unfortunately. And so you have to be able to meet your patient in the middle and provide a treatment that both you and the patient will be happy with. So a dentist also has many responsibilities, and a big one is to facilitate a positive environment for the team and for your patients. Patients are very, very perceptive, and they can tell if you're getting frustrated or if something might not be going the way that you want it to. And so you really have to strive to maintain a calm and personable demeanor. A big part of what we do is listening, because we always want to put our patients and their needs first. And so before we start doing anything, we have long conversations about what their expectations are, and we line those up with what our expectations are as well. We are responsible for planning appropriate patient-specific treatment. So as you can imagine, dentistry is not a one-size-fits-all profession. And so everything is very much done on a case-by-case basis. We are responsible for providing quality, ethical dental care. And luckily, I had amazing clinical training at the University of Iowa, and so I felt very prepared in that avenue. But there are a lot of different ways to practice dentistry that we didn't learn about in school. So you kind of have to take what you know and then pick the best parts of what you learn and then fuse that into what works best for you. We're responsible to referring to specialists when it's appropriate. So for instance, I don't take out wisdom teeth that are still underneath the gums, because a lot of times when patients have that done, they'd like to be sedated. I do not blame them for that. And so that is a procedure that I refer to our lovely local oral surgeons. Finally, we are responsible for reading and researching and bettering our skill sets. So that comes into the continuing education aspect of our career. And also a reason why I chose to go into dentistry, because it is a career that involves lifelong learning, and things are changing pretty much every day with all of the advances that we have in dentistry, with materials and incorporating digital dentistry into our practices. And so there really is something new to learn every day. When it comes to careers in dentistry, There are several paths that you can take. I am a general dentist, which means that I have training in all of these specialty areas, but also that I have the power and the option to refer to specialists when I see that is required or preferred. We always want to give our patients the best experiences. And sometimes that means realizing our own limitations and then forwarding them to the correct specialist to have their treatment completed. So we kind of touched on what all of these specialties do when I talked about my rotations. If you decide to pursue a career in a dental specialty, you are required to do a residency after dental school. So to be a general dentist, you do not have to complete a residency, and that's a big difference between dental school and medical school. But like I said, if you decide that you want to go into a specialty, it's an additional 2 to 5 years of extra training. So according to the U.S. News and World Report that was done in 2020, dentists are looking pretty good in terms of best jobs. General dentist was the number 2 best job. Orthodontists who straighten those teeth come in at number 4, and then oral surgeons come in at number 9. So even with all of the uncertainties going around right now, having a career in dentistry is very promising and very awesome. So now we'll talk a little bit about my office over at Marion Dental. This is the second dental office that I have worked for. My first office and we didn't really see eye to eye, and it's a very important thing to find a practice that fits your personality and your wants and your needs in treatment, and one that you feel comfortable in, because after spending all this time in school, you want to go to a place where you love going to work every day. And luckily, I have found that in my second office. On the left-hand side is Dr. Laura Fashier. She is the practice owner, also a general dentist. And then I am her practice associate, which means that I do not have a financial stake in the practice. I am not a part owner or anything like that. But I have all of the freedoms to practice all of my general dentistry skills. I just don't have to be involved in the business. I do have classmates that bought their own practices right out of school, and I commend them for that. I think it's amazing. But I personally didn't feel comfortable going right into that. I wanted to have some time to develop my clinical skills and to learn more about a business before I went and bought one. And so it's super awesome to work with an owner doctor and learn about the aspects of how to run a successful practice before I think about either buying in or buying my own practice in the future. So our team is pretty small for a dental office, but it works amazingly. We have 3 dental assistants, Erica, Laura Lynn, and Melissa, 3 dental hygienists, Carly, Heather, Laurel, and then 1 front desk insurance and scheduling coordinator extraordinaire, Jessica. So I am very fortunate at Marion Dental because all of these amazing ladies are also cross-trained. So if I have to do a filling on someone who is in a hygiene chair, the hygienist can also act as my assistant. My assistants, when we are done with the procedure, can take my patients up front and check them out and collect payment and then schedule their next appointment. So the teamwork atmosphere is so amazing, and I am so lucky to work with these ladies every day. So now we'll talk some numbers. Full-time in dentistry is considered 32 hours as opposed to your conventional 40-hour work week. So that's kind of nice. Right now, we aren't working our normal hours due to COVID, but if it was a normal situation, my hours are Tuesday from 10 to 7 and Wednesday through Friday, 8 to 5. I also work 1 to 2 Saturdays per month. In terms of average salaries, the average dentist salary in Iowa is approximately $150,000 per year. The salary for a dental hygienist is approximately $72,000 per year, and the average salary for a dental assistant is approximately $36,000 a year. So let's get to the good part. What do we actually do? People normally see us as these people who just ram around with drills and do a bunch of scary stuff, but we do a lot of really cool things. So the bread and butter starts with exams and x-rays. So we have to be able to diagnose a problem and then create a treatment plan that includes the teeth, the gums, and the jaws. We administer anesthetic. We can also prescribe antibiotics if there is an infection. As a dentist, we can clean teeth. So although we have hygienists, sometimes there is some overflow. And if I have an opening in my schedule, I can also do a hygiene appointment. We remove and fill cavities. We can repair or remove damaged teeth via crowns and bridges, implants, and dentures. We can straighten teeth either through bracket and wire orthodontics, which you have to do some continuing education to do, or Invisalign, which you also have to do some continuing education to do, but that's a great service to be able to offer to your patients in your office. We also do cosmetic procedures like veneers. And first and foremost, but finally on that list, we teach and advocate for our patients. So oral hygiene instruction is a big part of what we do. We can do a ton of beautiful work for a patient, but at the end of the day, if they don't know how to take care of it, then we'll be right back where we started in 6 months. So this was a day that I chose to show from my schedule. And it was a day where I had some pretty good variety. So I was working from 8:15 to about 4:30, and I did a little 20-minute lunch in there. Sometimes your lunch can be up to an hour. Sometimes you don't get a lunch depending on what's happening, but you just try and be flexible and do what you can when you can. So I started out and I had an initial exam. That patient had had a root canal done, so they were also coming to me for a crown. And so I started working on the crown that day. After that, I did a filling with some nitrous oxide, which is the laughing gas. And then after that, I took out a tooth. After my little break, I did a cleaning appointment, and then I finished the day with a bunch of fillings. So that's one thing that I really love about dentistry, is that it provides the opportunity to have a lot of variety throughout the day. And as a general dentist, I also get to pick and choose which procedures that I want to do, which is an amazing feeling. So if I decide that I don't really like doing root canals, I can send those to my friendly endodontist, and then I can spend my day doing things that I like more, like fillings and crowns. So what do I do when I'm not with a patient? There are lots of things that I can do. I help write procedure notes. So a very important aspect of dentistry is documentation. We want to be able to look back and see what was done. And it's also helpful when patients have to go see specialists or if they're transferring offices to be able to have all of their information properly documented. I write authorizations to my dental lab. The dental lab makes my crowns and bridges and dentures and all of those awesome things. And so we have to be able to tell them how we want those things made and with what materials. I check patients' ledgers. So we check and see that there are payments being made, and if patients have outstanding balances, and try and clean that up. Speaking of cleaning, sometimes I help clean and set up operatories. That is not part of my job as a dentist, but I am definitely one of those people that wants to keep everything on track and running smoothly. So if there's any way that I can help, I just jump right in there. I can also help sterilize instruments and equipment, so we make sure that everything is nice and clean for each patient. I return phone calls from the dental lab if they have questions about the case or from specialists. And I also field phone calls throughout the day from potential patients and insurance companies and a lot of other people. Finally, I drink a lot of coffee because I just have to in order to make it through my day. So coffee is very popular among dentists. So next we're going to talk about some of the most common procedures that I do, which are fillings and crowns. So why are fillings necessary? So when there are cavities or tooth decay, we need to get those cavities out of there before they grow and cause a bigger problem that may lead to a more extensive treatment or possibly even loss of the tooth down the road. There are 4 stages of tooth decay, and it's the best to catch them in the early stages before they become more involved in the tooth and it can cause bigger problems. So in the first 2 images, 1 and 2, the cavity is still in the outermost layer of the tooth, the enamel. In the third image, the cavity has made it to the second layer of the tooth, so it's coming very close to where the nerves and the blood vessels live. And that's what's happening in number 4, is that the cavity is so deep that it has reached the nerves and the blood vessels. And this is where you can start to experience a lot of pain and infection, and it requires a lot more extensive treatment to treat the tooth. So we perform just fillings on teeth that are in those first 3 categories. Once you hit that 4th category, then you have to go towards a root canal and a crown. And the first thing that we do is we clean up all of that decay. We take a look and make sure that there's none hiding out behind. And then we fill that hole that we have just made, that the cavity was once taking place in, with a tooth-colored material. After that, we shape and shine and make sure that the bite is still comfortable on the filling. And then we have successfully removed that cavity and hopefully prolonged the life of that tooth. So next, I'm going to show you a couple of my filling cases. And there is a little bit of blood involved. If you get a little squeamish, it's okay if you need to look away. The first tooth that I did here, and hopefully you can see my mouth, or my mouse, pardon, is this tooth right here. And it had an existing filling, and there is this shadow right here, which is where the cavity is that had crept in and started to grow underneath of the filling. And so this is an image where we have taken out that old filling and cleaned everything up. And then we also cleaned this failing filling on the neighbor tooth. And our goal at the end of the day is to make the filling look and feel as natural as a natural tooth without any material on it does. And some days that is a big challenge. And some days, you know, you're just having a good day and it rolls right along, but it definitely gives you the opportunity to be an artist and be creative. And this is an example of that second scenario where we're not left with very much after we have cleaned out this tooth. It had a very, very, very large cavity in it. And so it takes a lot of time and a lot of precision to build that back up to look like a tooth. But I think at the end that we got a pretty good result there. So that's always a great feeling. Next, we'll talk about crowns and bridges. So why might those be necessary? Teeth with large fillings at risk of breaking and fracturing could benefit from a crown. Similarly, if your tooth has broken or fractured, a crown can serve to replace that missing tooth structure and stabilize the tooth. We like to put crowns on teeth that have had root canals just to add another layer of protection. We can put crowns on misshapen or discolored teeth in order to make them look nicer. And we can also use bridges to replace missing teeth. So this is a graphic of what a crown preparation and seat would look like. So we start out here and there's a damaged area of the tooth. We then shape down the tooth so that way we can fit this crown over it and you can still bite together normally. And then finally we cement that crown into place. I like to think of a bridge as 2 crowns that are connected by a false tooth or a dummy tooth. So that dummy tooth is going to sit on the gums there and replace that hole where the missing tooth was. At the same time, those crowns are going to anchor that fake tooth into place. So this is a before and after of a crown preparation that I did for a patient. I saw him at his hygiene visit, and we had talked about putting a crown on this tooth because it has a very large filling. It also has a little cavity in the corner here, and there is a crack in the tooth as well. So all of those things can compromise the overall structure of the tooth. And we had talked about going forward with that, and he was on board. Well, then he was on vacation, and he actually broke out this part of his tooth. So in order to restore that missing tooth and to stabilize the overall structure, we went ahead and we cleaned that up and we prepared everything down so that way a crown can fit over it. And then we delivered him a very nice zirconia crown. So it's tooth colored and it fit right in with all of its neighbor friends. So just like any job, there are pros and cons to dentistry. And we're going to start with the pros. So it is a very rewarding feeling to be able to help patients achieve better oral health and then therefore better systemic health. You have a lot of bacteria that can do some pretty nasty things if they travel from your mouth into your body systems via your bloodstream. And so helping people keep their mouths healthier also helps them stay healthier overall. Boosting self-esteem and confidence and making patients proud and happy to smile is without a doubt my favorite part of my job. It is the best feeling to have a patient that is really scared to come to the dentist or not confident with their smile, to be able to turn that point of view around and have them leave happy and feeling good and looking good. I am very fortunate to work in an office where there is an amazing teamwork environment and people are willing to help at the drop of a hat, and that makes our days run much more smoothly. I do have more of a flexible schedule, in part because full-time is 32 hours. So it's not really your normal Monday through Friday, 8 to 5. So I have Mondays off, but then Tuesday I work a longer day. And then I also throw in a Saturday every once in a while. So there's a little bit of variety. Finally, I get to do something that I love all day long. And that is such an incredible feeling. Not being able to do my job right now is very, very sad and frustrating. And I can't wait until I can get back in the chair and get back to helping people. So there are some downsides to the job. There are situations where you deal with patients who, due to health problems, can't lean back all the way in the chair, or they can't open their mouth all the way. And so you have to be able to move and bend and twist like a contortionist in order to best be able to treat them. And sometimes that leaves you a little bit sore at the end of the day. Dentists are very good friends with our chiropractors and our physical therapists. Dentistry, unfortunately, is expensive. And so a lot of times, like I talked about earlier, we end up making compromises between what is ideal and then what the patient can afford. And that can be frustrating for both parties. Working and talking and teaching all day long can be pretty exhausting. There are definitely days where I get home and I just eat dinner and I go to sleep because I need to rest and get ready for the next day. Sometimes it can be difficult to meet and manage lofty expectations or to please difficult patients. And so there are a ton of dentists out there, which is amazing. And part of that is because I might not be the best dentist for everyone. And that was hard for me to accept when I first started out. But at the end of the day, we want to give our patients the best dental experience. And so if that means that a patient has really lofty goals that I know that I won't be able to meet them, then sometimes I have to send them to another provider, and that's just part of the job. But it also is very frustrating because you want to be able to help everyone and to please everyone. Finally, there are some cases that are very challenging and multidisciplinary. So when we work with oral surgeons and endodontists and prosthodontists, and that can be difficult to plan and coordinate, especially if your patient misses one of those appointments, or if they need longer healing time or anything like that. it can throw a wrench into your plan, and that can be pretty frustrating at times. So what are some things that you can do now if you are interested in a career in dentistry? This first one seems obvious, but I can't understate it enough to work hard. To take challenging and college prep courses. It might be out of your comfort zone now, but those two things are definitely going to help prepare you for both college and dental school. Finally, you can job shadow your local dentist or specialist once we open back up. And because we're right across the street, that's very convenient. So if you want to come hang out, we do have a pretty fun time doing dentistry. Not every dentist experience has to be a scary one. So with that, thank you very much for your attention, and I will answer any questions that you might have. Cheryl, are you there? Okay. Oh, okay. Here we go. Okay, so Allie asks, what are some education requirements for dental hygienists? So dental hygiene school is usually either a year or 2 years long. There are some combination programs where you can become a dental hygienist and a dental assistant, and I am not as familiar with those. But a lot of the requirements are the same in that they are in science-based curriculum. So you definitely want to try and take as many science classes as you can. And the second question is, would you recommend dental hygienists to get a bachelor's or to go to dental school? So I think that you can go on and get a 4-year degree if you want to out of high school. That's super awesome. You can go to hygiene school at a lot of different points throughout your education, depending on how many credit hours you have accumulated. But when you go to dental school, that is to become a dentist. So dental school and hygiene school are two separate things. The third question is, what is the difference of a day-to-day routine between a dentist and a dental hygienist? And this is a very good question because we can do hygiene, but there are a lot of things that our hygienists aren't able to do. So our hygienists clean teeth all day long from 8 to 5. And sometimes that is a normal cleaning like you've probably had. And sometimes that is a deeper cleaning where patients have to get numb before that happens. And so they are doing pretty much the same thing all day long, where I might be doing a filling and then a crown and then removing a tooth. So there is a little bit more variety on my end of the spectrum. But I also feel like patients have the best relationships with their hygienists. Sometimes I get a little jealous because they have a lot more fun over there than we do. And so they really get to know the patients and can help talk to them about treatment. And they are superstars. So we really appreciate them. The fourth question is there different education requirements between adults or pediatric dentistry? So at the end of our 4 years, we are able to treat both children and adults. A reason why you would go into pediatric dentistry would be if you wanted to treat the more advanced cases, or if you wanted to be able to sedate those patients or possibly work on them in an operating room. And so you can go on and complete a 2-year pediatric dental residency. But at the same time, I can treat as many kids as I feel comfortable with as I want. The fifth question is, was dental school stressful? Would one be able to have a job or do other activities during that time? So dental school was probably the most stressful 4 years of my life. I won't lie. It threw me a lot of challenges, but it was also the best 4 years. And I made some of my best friends in dental school, and I gained so many personal and professional relationships that I think the good times outweighed the bad at the end. It is actually frowned upon to hold a job while you're in dental school because your job is to be a student. And there were some students who might have had a part-time job at the beginning, but school really, really ramps up, especially in those second through fourth years, and there really isn't much time to hold a job. You can definitely do other activities, though. I did a lot of research when I wasn't in dental school, and that afforded me a lot of opportunities to travel throughout the United States and to attend conferences, and that was really cool. We also have extramurals, just like they do, or intramurals rather, in undergrad. So a lot of the more athletic people in my class got together and they did flag football and volleyball, and that was really cool because we got to make up really nerdy dental team names and nobody knew what they were, but it was awesome. And we also have fun activities that we put on at the dental school. So every year we have a dental prom, which was really fun. Everyone gets dressed up and there's dinner and dancing. And there are also a lot of clubs within the dental school that you can be a part of. So there is a club for students who have a military dental interest. There is the Hispanic Dental Association, and they do a lot of outreach with the Hispanic population, and they host Spanish classes over lunch for us dental students, which is really cool. And gosh, there are so many student organizations in dental school that I can't even think of all of them, but there are a lot of other ways to be involved and still do fun things while you are a dental student. My next question is, does Iowa offer hygiene school? So there are a handful of hygiene schools in the state of Iowa. The University of Iowa College of Dentistry itself does not have a hygiene program. However, part of dental hygiene involves a rotation at the College of Dentistry. So we have hygiene students that are in the school, but the College of Dentistry doesn't have its own hygiene program. Hopefully that makes sense. It's kind of confusing to everybody.
I agree. No, it was great.
I agree. Thank you, Dr. Recker.
Absolutely. Thank you for having me.